The member for Edmonton-Meadlowlark, followed by the honourable member for Calgary-Buffalo.
Thank you, Mr. Speaker. I'd like to thank the honourable member of Edmonton Highlands Norwood for asking leave to have this very important conversation. While I may not necessarily agree with all the wording, I would agree with the intent that this is a very important issue that affects all of us in our society. Now, Mr. Speaker, I'd also like to thank all of my colleagues as well in this legislature for their unanimity and agreement with the honourable member to have this discussion. I'd just like to talk to you just to explain to everybody about pandemics and H1N1. Now, to put everything into perspective, years ago we had the SARS that had hit the world, and that caused a lot of fear across the world. And that's when all these pandemic plans were implemented. The planning began all across the nation, all the hospitals and all the health regions and provinces. Now then there was H5N1. H5N1 was this scary bug that we all worried about because it truly has anywhere between 10 to 20% death rate. H1N1, we didn't know much about this when it first struck. You would watch CNN and see Dr. Sanjay Gupta running through stairwells of hotels, and we didn't know what was happening. As we gained more evidence and more data, this is what we do know about H1N1, to put it into perspective, not only for my friends here in the Legislative Assembly, but also for all Albertans. Regularly every year from the regular flu, we expect about 4,000 to 5,000 Canadians to die from the regular influenza flu. And that's tragic. And those people are usually the very young and the very old. From H1N1, from the Australia experience, what we've learned, we have the fortune of having our winter after theirs. From their experience, assuming nobody was vaccinated in this province, we would expect about 875,000 Albertans to contact the H1N1 influenza. The challenge there is nobody has immunity at this point in time unless you were born before 1918. Of those, we expect 400 deaths.
Maybe Ken Coles.
400 deaths, assuming nobody was vaccinated in this province. We will have a large number of people who will get quite sick and require hospitalizations. So 875,000 are expected to get the flu. A few thousand are expected to get sick enough to be hospitalized. Of those, 400 are expected not to survive. Now, what we really need to concentrate on is number one, on prevention. The importance of hand washing and maintaining your distance from people who are sick. And if you're sick, to stay home and to decrease transmission of the virus. Number two are the vaccination programs. This is the largest mass vaccination program in this nation. And I do have to say, apologize to all those folks who waited for so many hours and weren't able to get the vaccine. I am, however, very happy that we were able to roll out 400,000 vaccinations in a very short period of time, very efficiently. Now, the challenge is our supply of vaccine is not fully there as we had expected. Now, there are a number of people, of those 400 deaths, there are a number of people who identified as high risk. Those between the ages of 5 months, 6 months, and 5 years, pregnant mothers, those with chronic medical conditions, who have diabetes, heart disease, lung disease, neurologic disease, who are on immunosuppressant drugs, and many members of our remote Aboriginal communities, and many members of our society who have morbid obesity. And I am aware right now today we have 16 confirmed cases in the intensive care units on ventilators. I'm also aware that there are a few 23 and 26-year-olds and 50-year-olds who have no risk factors, who also are on ventilators. Now, we still have 3.2 million people to vaccinate, Mr. Speaker. We're very early in this. And I'm glad this is an emergency debate. As an emergency doctor, when these things happen, we always ask for calm. We all need to just calm down a little bit. We have a lot of work to do. We have a long way to go. We have 3.2 million people, I'd like to repeat, still to vaccinate. For any vaccination program to be successful, there's something that we call herd immunity. My neighbor here may not be at high risk, but they may have a family member at home who is high risk. And to get herd immunity, we need 60% of our members of our society to get vaccinated. And I'm thankful to the members of the opposition that they agree with the vaccination program, because there are many people out there who don't agree with vaccinations. Now, the peak of the flu was expected in about 6 weeks' time, and we'll have another wave in January or February. Today is not the peak of the flu season.
Wow.
Now, on the vaccinations, the vaccination program, there's something called an adjuvant. Adjuvant is really an oily substance that they place in your arm. It helps to maintain the vaccine in that location for a longer time, so we get a better immune response. But we only need to use 1/4 of the vaccine. So you're getting a better response with 1/4 of the vaccine. So we've been able to stretch with the adjuvant our vaccine supply fourfold. The challenge recently with the supply is that because of the uncertainty and concern over pregnant women, they're designing a special dose just for pregnant mothers. And they've had to put the production of the vaccine on hold. So I ask all Albertans, number one, to wash your hands, and before you eat, wash them regularly, and if you're sick, to stay home. Now, of those patients who do get sick, if you're a high-risk Albertan, you need to see your healthcare provider, and we have a treatment for the flu. You need to get that treatment, preferably within 48 hours. We can stretch it to 72, but preferably within 48. Secondly, of those Albertans who get very sick, the initial symptoms will be sore muscle aches and pains and cough and loss of appetite, fatigue. That's normal when you get the flu. But if you get chest pain, shortness of breath, or signs of significant dehydration, you're feeling faint, or just really sick, you need to see a healthcare worker, because one, we need to get you some fluids to rehydrate you, we need to assess your vitals, and we need to get you this medicine for treatment if you do get very sick from H1N1. But for the vast majority of Albertans, and that number, I don't have the exact number, but it's in the 90%, and then some, most patients will be absolutely fine. They will be sick from the flu, they'll have fevers and chills. I ask that they stay home and get lots of rest, drink lots of fluids, and don't transmit the virus to members of your family or members of your community. The challenge we face in the front lines is, because of all this fear that you hear in the media, everyone is so scared, and they're showing up to the emergency department. Yes, they have the flu, but they're not that sick. And then we have a number of people who actually probably need to go to the emergency department because they're in that high-risk group or they are very sick.
That's right.
And what that's doing is placing an undue burden on the frontline staff. They're working tremendously hard, Mr. Speaker, and you have to give them credit. I still work every Sunday, and alongside many of the healthcare workers in this province, they're working very hard to provide care to Albertans. I want to remind everybody, H1N1 is not the only medical issue out there. What this does is places a challenge on delivering health care to everyone else. And this is a national issue. It's not a made in Alberta issue. It's not a made in Canada issue. It's an international issue as well. So, Mr. Speaker, despite the fact that this is not SARS, this is not H5N1, we still need to deal with this issue. And we have a healthcare system to run. And we need to run this together. Now, I've had the opportunity to visit the emergency departments in Edmonton and Calgary. I just phoned my colleague at the pediatric emergency department. They're open for business. They're very busy with a lot of people with that H1N1, suspected H1N1 showing up. But all the admitted patients have been moved out of their ward so they can deal with all the sick children showing up to the Stollery Emergency for Northern Alberta. And we have these flu assessment clinics. One opened up in Duggan yesterday in Edmonton. They saw 311 patients quickly, rapidly, and they relieved a lot of the burden off the front lines in the emergency departments. There is a stage 0 to stage 4 plan that they have for the intensive care units. And I met with ICU docs, We're at stage 1. There's a long way to go, and there are plans in place to deal with this if it ever gets that bad. Mr. Speaker, I just ask all members of this Assembly to unite, to work together on this issue, and the solidarity to support frontline staff, and ask all Albertans to be patient and to allow those who are high risk to get this vaccination program first. And if you fit that high risk category and you're sick, please get treatment earlier. Thank you.